Welcome to this explainer. If you're managing COPD, you're probably hyper-aware of your lungs, right? You track your breathing, your coughs, your overall energy. But what if you look down one day and your ankles, feet, or legs are suddenly swelling up? And crucially, you don't have any prior diagnosis of heart failure. Honestly, it's a terrifying moment for a lot of folks. But it's also a massive window of opportunity. Today, we're unpacking exactly what this lower limb edema means and precisely what you and your doctor need to do about it right away.
To break this all down, we'll quickly run through when lungs affect the heart, a practical patient guide to swelling, key warning signs, the clinician's diagnostic playbook, and finally, immediate actions and emergency care.
All right, let's jump right into part 1, when lungs affect the heart.
So, you might be wondering, my lungs are way up in my chest. Why in the world are my shoes suddenly too tight? It's a genuine medical mystery for a lot of patients, because we tend to treat our bodies like these perfectly isolated systems. But here's the deal. COPD can prevent enough oxygen from getting into your bloodstream, while simultaneously trapping carbon dioxide inside. And over time, this chronic lack of oxygen creates this massive systemic ripple effect across your entire cardiovascular system.
This right here brilliantly illustrates that hidden link. COPD can actually lead to right-sided heart failure, which clinicians call cor pulmonale. Basically, when your oxygen levels drop and stay low, your heart has to work so much harder to push blood through those damaged lungs. Eventually, the right side of the heart gets enlarged and weakened from all that intense strain. When it can't pump efficiently anymore, fluid starts backing up in your veins and, thanks to gravity, it pools right down in your lower limbs. So that swelling, or lower limb edema, is literally the check engine light of your cardiovascular system flashing red. It's your body's way of saying, hey, the lungs are now seriously impacting the heart.
Which brings us to Section 2, our patient guide for dealing with swelling and COPD.
Okay, put yourself in this specific scenario. You have COPD, you don't have a heart failure diagnosis, and bam, you notice new swelling in both legs. Specifically, we're talking about pitting edema, where if you press your finger into the skin, it leaves a temporary little indent. What's your immediate move? Well, the sources suggest starting with the super practical feet up test. Step 1, get those feet elevated above your heart level. Step 2, sleep overnight with your feet propped up on some pillows. Step 3, check that swelling first thing in the morning. And here is the absolutely crucial takeaway. If a night of resting with your feet up doesn't clear the swelling, you need to contact your healthcare provider as soon as possible. Seriously, do not wait for your next routine appointment. This new or worsening swelling is a definitive sign your condition is changing, and it needs checking out immediately.
Moving on to Section 3, warning signs and red flags.
When you see that swelling, you've officially entered the yellow zone of your COPD action plan. This means you need to be hunting for other subtle clues that this isn't just your standard respiratory flare-up. You absolutely must monitor for these specific red flags. First, any unexplained weight gain. Often, this isn't fat, it's literally just the heavy weight of that retained fluid sloshing around. Also watch for worsening shortness of breath. Maybe you suddenly can't walk as far as you usually do, or you're fighting for breath when you lie down at night. Frequent morning headaches or dizziness, total red flags. Those can point to a dangerous buildup of carbon dioxide in your blood. And lastly, look out for extreme, completely unexplained fatigue that lasts more than a day. Spotting these clustered changes early is absolutely vital to stop this from snowballing into a severe crisis.
Okay, let's flip the script. Section 4, the clinician's diagnostic playbook.
So what exactly should your respiratory clinician be doing when you walk in with recent bilateral pitting edema? According to the 2023 Gold Report guidelines, their primary focus has to be investigating potential cardiovascular complications. Their biggest hurdle right off the bat is distinguishing between a standard COPD exacerbation and decompensated heart failure. Heart failure is basically the ultimate mimicker here. It can mimic or even aggravate a standard exacerbation. Because both issues cause severe shortness of breath and fatigue, your doctor has to play medical detective. They need to figure out if this yellow zone trigger is a respiratory infection needing antibiotics or a congestive heart failure complication that requires a totally different management strategy.
To crack the case, the clinician's playbook mandates a few highly specific moves. First up, they are specifically recommended to perform an electrocardiogram, an ECG or EKG. This checks heart function and helps rule out primary heart disease as the root cause behind the symptoms. Next, they'll use pulse oximetry to precisely assess your blood oxygen levels, which, as we'll see in a second, is critical for treatment. Finally, they need to confirm your physical history. They should be asking, did you try the feet up test? As the swelling persisted, have you noticed any rapid, unexplained weight gain? This combined physical and diagnostic data tells them exactly where the system is actually failing. Let's wrap things up with Section 5, Immediate Actions and Emergency Care.
This brings us to the actual clinical decisions. And this number is incredibly important. Say the clinician measures your oxygen and finds a resting arterial hypoxemia, specifically a PaO2 level strictly below 60 millimeters of mercury. If that low reading is paired with signs of cor pulmonale, like that persistent leg swelling we've been talking about, the immediate action is to initiate long-term oxygen therapy. This isn't just about making you feel a bit more comfortable. The clinical guidelines are super clear. Providing supplemental oxygen in this exact scenario directly increases patient survival. It literally kicks the pressure off that exhausted right side of your heart.
But listen, not everything can be handled in a standard clinic visit. If the clinician or even a caregiver at home spots any of these severe signs, the protocol is clear. Get to the emergency department immediately. We're talking about sudden or severe difficulty breathing that totally ignores your rescue inhalers. We're looking at neurological changes. If you or your loved one becomes surprisingly restless, confused, unusually irritable, forgetful, or starts slurring speech, those are massive red flags, meaning the brain is either starving for oxygen or drowning in carbon dioxide. Also, a high fever over 103 degrees Fahrenheit or 40 degrees Celsius means a severe acute infection is in play, and it could rapidly overwhelm a compromised system.
The absolute biggest takeaway from all of this: COPD is not just a lung disease. It's a systemic condition that intimately affects the heart. That sudden tightness in your shoes or puffiness in your ankles is not just getting older or something you can brush off. It's a powerful, vital warning sign. Recognizing this single symptom early gives you the power to change the outcome, prompt the exact right clinical tests, and get the life-saving oxygen therapy or heart treatments you might need. So I'll leave you with this. Knowing what you know now, are you prepared to take action the very next time you enter that yellow zone? Thank you so much